Hi Professor, this is Shelly Litchfield. I'm doing my assessment actually for week 5. Sorry it's a bit late, but I don't have a lot of the equipment that's required. But I thought I'd walk you through what I would do in eyes, ears, nose, and throat assessment anyway, so you can at least see what I would do on a normal basis. I work with kids, not really more in a therapy capacity rather than nursing, so most of my equipment I'm not able to get access to. And then I tried to get into a couple doctor's offices, but I wasn't able to get into any of my friends' doctor's offices to do this. And right now the money's a little bit tight, so I can't really afford to spend $100 or $200 on equipment. So, like I said, anyways, this is my assessment video for eyes, ears, nose, and throat. So I'll start with eyes. When I'm looking at the patient's eyes, I'm looking first at their pupils, whether they're equal in size and diameter. If they're large, which would indicate maybe some type of brain damage or some type of hormone response, or if they're constricted, which could also mean a couple other things. I'm also looking at their veins in their eyes, that everything's equal, that the outside is round, and that there isn't any discharge coming from the eyes. In our textbook, it talked about doing a Snellen chart, which is where I'd have the patient, which is my husband again, who's helping, stand from 20 feet back and read through the top of the chart, basically testing his visual acuity. And it basically tells us what someone can see at 20 feet, what I can see at 20 feet, someone should be able to see at 20 feet. So that's what the Snellen chart tells us. My husband without the glasses would not be able to see it, but with his glasses, he just got them checked recently, so he's got 20/20. So that would be that. The other thing I do check is pupil reaction to light, just to make sure that the pupils constrict. Sorry, when light crosses them. All right, so next I'm going to go to the ear portion. I do, again, have an otoscope, so you're just going to have to, I'm using a flashlight for this purpose. Again, I just don't have the equipment. So what I do look for again, and our textbook has told us to look for, was first to look at the outside of the ear and look for any redness, because sometimes that can be an indicator that something's going on. Obviously, check around and behind the ear, make sure there are no lesions going on or anything on the outside before we look in the inside. And then looking in the inside of the ear, we're looking to see what color the membrane is, whether it's gray, a light pink, a little yellow, which is common with earwax buildup, a whitish color, which can indicate infection, whether the membrane is shiny or dull, again, which is indicates fluid. We also would do a hearing test. I was actually able to perform one of these in nursing school, hearing test, where you have them put an earphone in one ear, and then they have them play a noise, and they hit basically, or they say when they can hear something, and you base it off of a chart of results, and that's how you test their hearing. Another thing that we like to do in the nursing homes was whisper something in their ear, such as, what did I say?
Bird.
So we test and see whether the patient can hear in the ear, or we would do our fingertips in their ear and ask them if they could hear this. Or actually, we wouldn't ask them. They would only respond when they said that we were doing something next to their ear. Okay.
Sorry, I could hear it.
And then last, I want to do the nose and the throat, which I have most of it except for the nasal speculum. So first thing I would do is look at the outside. I would look at the bridge of his nose. I would notate if it's ever been broken before, or it looks like it had a bump, if it was crooked septum, because that can cause a lot of problems with breathing. I would also inspect outside of the nostrils, make sure that they were open passages, if there wasn't any collapsing going on. That could again cause problems with bleeding breathing and drainage. Look up your nose now, so close your eyes. And So you're just looking to see if you see classic clear mucus. It can even be a little tiny bit of yellow or white. It's usually indicative of an infection if there's obviously blood or green tinge or strong yellow. Another reason for having that color mucus could be allergies. So it's usually when I'm doing this for a patient, I'll start asking them about what their history is. And do you have any history of allergies?
Yes.
Okay. Do you normally get them at a certain time of year, or are they all year long?
Usually only in the springtime.
Okay. Do you have a history of sinus infections? Do you mind if I press on your sinuses?
Sure. And yes, I do.
You do. Does any of this hurt?
No. A little.
It actually does hurt him because he has a little bit of an infection going on right now, which is why he laughed. So the other thing is you have to look for all the signs that a patient may not be willing to tell you, because a lot of them don't like being sick because it is quite miserable being sick. So the other thing that they wanted us to talk about, and I would get, if I was in a doctor's office, one of the ways that we would get a sample usually is a sterile swab of the nose if we were worried about infection or testing for a virus possibly. And that's one way that we can test for the flu virus. So I'm going to actually look in his mouth now, which is the last part of the assessment that our textbook talked about in this chapter, or these chapters I should say. I would look at the lips first, make sure there's obviously no sign of lesions or cracks or anything that would automatically make me assume that something might be going on, even dry mouth or something like that. The lips can actually tell you a lot about the mouth. I then ask him to open up. I'm going to look at his teeth, see if there's any signs of inflammation. One of the things that we learned about was that it's even important to look at the teeth because a lot of people get cavities and they don't get it checked out, and they can actually get infections going down the back of their throat, impaction on the side, and they think they have strep or something else. So it's really important to check the entire mouth. The other thing you want to check is the cheeks and the tongue. You're looking at the mucosa and the consistency of the fluid. Again, thick fluid, dry mouth, any of these things can be symptoms what you're looking for when you're trying to diagnose something. Well, not diagnose, but try and figure out what's going on with them. Okay, and then I would ask for you to open and say, oh yeah, you do have a nice little infection going on. And then I would say go ahead and close. And this is where I would, again, feel to kind of go and say, is any of this painful for you?
Nope.
And it is painful, so I know he has an infection. Again, we're looking for wincing, we're looking for anything like that. I would also ask him questions about his throat. If he had a cough, if it was dry, if it happened more at night, if it happened more in the morning. All of this I usually do when I'm doing the mouth and throat assessment and nose, because I find that if I move on to the lungs too quickly, I'll miss some of the symptoms that I would think of for drainage. I would ask if it got worse in the morning, if his headache was better after a shower, if anything helped a sore throat or made it better, or if sleeping was becoming difficult. So that's the basic assessment that I can do without the equipment. I promise the next couple assessments are a little bit better because I actually have everything. And that's it. So thank you very much for watching. I appreciate it.